Hey guys, welcome back to my channel. It's me, and today I'm going to talk about the current medication that I'm taking, post-op hip replacement, and it's a lot. So let's jump right in. First thing in the morning, I'll have to take this, which is a digestive. It kind of protects your digestive tract. So because you're taking all these medications, you might get stomach reflux and it might hurt your tummy to take all of these medications. So first thing in the morning, before eating any food, I have to take this, just one pill. This is a 20 milligram. Then I wait about 20 or 30 minutes, and then I have to eat. I have to have a pretty chunky breakfast because I'm taking this antibiotic. This is cephalexin. This is a wide spectrum antibiotic, and this is, let me check, 500 milligrams. And I take this in the morning and at night, so every 12 hours. This one is just once a day, and this one is every 12 hours. With my breakfast, I also take pain medication. This is acetaminophen or paracetamol. This is also 500 milligrams, and I take 2 of these with 1 of these. This is I don't know how you call this in English. In Spanish is naproxeno. This is also pain medication, but it also helps reduce the swelling. And this is 500 milligrams, and I only take 1 of these. These 2 I take every 8 hours. So in the morning, after lunch, and at nights. Also, in the mornings, I take these drops. These are opioids, tramadol. I don't know how you call this in English. I take 5 drops of this. This is a pretty heavy and mighty powerful medication. It kind of makes me drowsy and dizzy, and sometimes it helps me to sleep. So I also take this in the mornings, around, I don't know, 9 or 10 a.m. I cannot combine this. Because they don't cancel each other, but it's better to just take them separately. And for the drops, I have a spoon right here. I'm about to take them, so clean spoon for this. Only 5 drops, because that thing is pretty mighty. And at nights, after taking the 3rd doses of this and the 2nd doses of this, I take pregabalin. This medication, it's commonly used for seizures. People with seizures, this helps them, but in this case, they gave me this because it cancels my neurotransmitters. What does that mean? It tells my brain that I don't have pain. That's it. So this tells my brain, hey, unplug all the transmitters that give the information of where you have pain. They pretty much unplug this, unplug those on my brain, so my brain doesn't think that I have pain, and this really helps. This also makes me a little bit dizzy, and this helps me to sleep a lot. The precaution with this medication is that you cannot combine all of this. I'm going to talk about this later, but you cannot combine all of this because all of them makes you dizzy, and you kind of can intoxicate yourself, and if you take all of this together, you pretty much end up in a bad trip. Another precaution with this is that it cannot affect your mental health. So in some clinical trials, patients had shown that after taking this for 2 or 3 weeks, they get intrusive thoughts and suicidal thoughts. So if you have a mental health problem, you have to talk about this with your doctor. I talked about this with my doctor because I do take Zopiclone on a daily basis to sleep, and that's pretty much a mental health problem. According to the prescription, I'm only going to take this for 2 weeks, and you take only one of these a day at night. After like hour and a half after this, then you take this. This is a 75 milligram, and 1 hour and a half later, or almost 2 hours, I take my Zopiclone. This I do take on a daily basis because I cannot sleep, I cannot stay asleep. So I take this Zopiclone. This is a very small pill. It's a 7.5 milligram pill. And all of this together have helped me to sleep a lot. I am quite like a zombie all day because this can make you a little bit tired and dizzy. This makes you tired as well, and overall the whole process of healing is completely normal that you have to sleep a lot. And I'm sleeping around 10 to 12 hours a day, not much at nights because I get tired of laying on my back all the time, but I do take like 2 or 3 naps a day. And the other one is the enoxaparin. So yeah, it's a lot of pills and injections. The medication has helped me to sleep a lot. Right now I'm really tired. I'm tired all the time, probably also because I lost some blood during the surgery. I didn't get transfused. I didn't get any blood transfusion, which is really good. That means everything went absolutely great and my body is healing nicely. But I'm really tired all the time. I don't know if you guys can see that in my face. I'm really tired. And yeah, my recommendation when you have all of this medication, no matter what procedure you had or what condition you have, is one, you have to eat really good. You have to be eating all of the time. Take a bunch of liquids. I do have my water bottle here. A lot of liquids so your body can process it all. And have an alarm. I have like 10 or 12 different alarms because I forget the time. Maybe I'm sleeping. I don't remember what I have to take because it's a lot of crazy names on the medication. And I always have by my side the medical prescription. So if I have any questions or something, I can always go check the prescription. Everything is there. And yeah, I'm going to take my medication right now. I'm going to do the enoxaparin shot, and I'm going to take my tramadol. I'm not in pain right now, but you do have to take it. No matter if you have pain or not, you do have to take it. And I guess I'm going to go take a nap because I'm really tired. Oh, and this makes your blood thinner, so you don't develop any clots after the surgery, because during the surgery they were messing up all the internal tissues in the bone, and there's a higher risk that you develop a clot, and that's really dangerous. So they gave you this medicine to make your blood thinner in order to avoid these clots. And one of the precautions with this is that you should avoid sharp objects or injuries, because if you cut, for example, your finger or have a scratch somewhere, it can bleed a lot. So staying away from sharp objects, therefore I cannot cook because I cannot chop anything. I haven't trimmed my nails either. I'm very careful when I'm walking so I don't fall. And yeah, that's pretty much it. So this is enoxaparin sodium. It is an anticoagulant. It's an injection that I have to do every day, once a day. And the good thing is that it's all in there. It's already prepared. You don't have to, kind of mix it up or anything, or take it out of a glass. It's all in there. It's ready to go. And I inject it in my tummy around my belly button. It doesn't hurt that much. It's just the first stinge when you put the needle in. And yeah. So I'm ready to take my shot, and first of all I'm going to disinfect my hands, although I already washed them because I just went to the toilet. And this is a pretty straightforward procedure. It's not a big deal. I'm sorry if this is triggering. If you are afraid of needles, please skip ahead because it's about to be very, very explicit. Okay, so next I'm taking a cotton swab. I'm dipping it into a little bit of alcohol. And I'm just going to disinfect my belly button and the surrounding areas. I don't know if you can see it, but right here I had my shot yesterday. And once it's all disinfected and clean, I'm going to take the needle. I already opened it. I'll take the cap off. That's the needle. It's really, really small. I don't know. It's really small. And what I'm going to do is, because yesterday was here and the day before was here, I'm going to do it above my belly button, and I'm going to kind of measure 3 fingers, and this is the spot where I'm going. So I'm gonna pinch the skin, and in a 90-degree angle I'm going to insert the needle and just push it. Oh, that stinks. And out. And that's it. That's all you have to do. This mechanism protects the needle so that you can dispose it properly. And right here at home I don't have a red basket like to properly dispose these, so I'm putting this in a plastic bag individually, and once I go back to the hospital I'm taking them and I'm going to dump them at the hospital. Yeah, that concludes this video. Thank you guys for watching. Please subscribe, give it a thumbs up, comment. I really appreciate when you guys cheer me up. It really helps. And I guess that's it for now. Bye.